Good afternoon, everyone. Welcome to the Education Continuation Task Force on June 29th. We have a pretty full agenda today. I want to start out by thanking everyone for your participation in the task force over the last few weeks and months. That enabled us to provide the Department of Public Health with a lot of great feedback that resulted in the what we're calling the flagship guidance document that was released last week with a lot of details about reopening school and things that are required as public health expectations, and then other things that are best practices. And so I think that was we have a lot of anxiety, of course, related to going back to school, but I think that release of that document yesterday was helpful, and it provided some additional direction. And I know we will continue to have questions and issues that arise as we continue on, which is exactly why we're going to continue to have this task force and every other week, and then the Superintendent's Advisory Council on the Mondays when we are not meeting as a task force. And I anticipate that continuing through the summer, and at least until we get to the beginning of the school year, which leads me into the next topic, which I want to just briefly give you an update on the search for the next Commissioner of Education. The state board doing a lot of work, very busy on that search. The board met last week to further narrow the candidates, and it's my understanding the board will be releasing the names of the top finalists at some point this week and make those names public, which is consistent with how searches have been handled in the past. And so you will have the names of what's estimated to be, I guess, 3 to 4 top candidates. And then the board will meet again on July 6th and 7th of next week to have in-person interviews with those candidates, of course, utilizing social distancing as appropriate, and could have a decision by the board as early as the 7th. And so we could have the name of the person selected by then. And then, of course, we hope the person, or at least I certainly hope the person, is on the ground soon. Probably, I think August 1st is not out of the question, and maybe on into August, depending on whether that person selected has other commitments this summer, and of course would have to give notice and may have vacations or things planned. So we're looking at the new commissioner arriving somewhere as early as August 1st to as probably late as September 1st. So I know we're all excited about that, and so stay tuned for later this week for the announcement of the top candidates. Today's topics, we're going to go over the food service guidance and the transportation guidance. Those are guidance documents that have already been issued based on feedback from this group and others, but we also want to go over these documents once they are issued to talk about implementation, because they are guidance documents, because of the changing nature of the coronavirus. We know that sometimes we can change. We may need to change or alter some of our guidance based upon issues that you and your members are encountering out in the field. So we will have reviews of those, and then we have some task force member news from Marshall Wilcox, and then we also thought we would have some additional discussion about the safety expectation and best practices from the document that was issued last week. I see the Lieutenant Governor has joined us. Do you have any welcoming remarks before we get started?
I always have welcoming remarks, Kevin. Just kidding. Thank you guys for coming together again today. I know we've gotten lots of questions and input along the way, and we still obviously continue to welcome that as our task force takes on the evolving issues that we continue to see coming out of this pandemic. So thank you guys so much. And Kevin, thank you for your leadership. You've done a wonderful job in really difficult circumstances. And I know that you will be glad when we have a permanent commissioner on board, but you've done a great job, so thank you.
Thank you. And it has been because of all the work and all the partnerships we have out there in the school districts, and of course the talented folks in the department, and Lieutenant Governor, your staff have been amazing to work with, and the partnerships we have there, and also with public health. So it's been certainly a team group effort. We will start out with a discussion around the food service guidance with Lauren Moore, who's our director of the Division of School Community Nutrition. I think she's going to also be joined by Katie Embry of that same division.
Yes, hi, good afternoon. I'm going to share my screen with you all. So if you can just tell me when you can see it.
We see it, Lauren.
Great, thank you. So we're glad to be here with you today, and we're going to, as Kevin said, we're going to go over our food service operations guidance. My name is Lauren Moore, Director of School and Community Nutrition, and joined with our schools branch manager, Katie Embry. First, before we start with our guidance, I do want to just give some quick updates about our child nutrition program initiatives. We are working very closely with the Cabinet for Health and Family Services on the Pandemic Electronic Benefit Transfer Program. And as of today, those benefits have gone to over 515,000 students, and that is $155 million in benefits. That application is open until July 10th to allow eligible families to apply. So we are very happy that those benefits are getting out into the hands of our families to support our students in Kentucky. We have 20 districts participating in the Baylor University Emergency Meals to You program. This program allows households in those 20 districts to receive 10 days worth of meals by mail every 2 weeks. And those benefits will continue through August 15th of this year. We also have districts who have continued to do summer food service program meals as well as seamless summer option meals. And then finally, we're working very hard on our community eligibility provision participation. And we have 76% of sponsors currently who have full participation. And what this means is that the schools in those districts provide meals at no cost to all students in their district. And districts who are not currently participating but would like to participate still have until August 31st to elect participation. We received some very good news last Thursday regarding meal program waivers from the U.S. Department of Agriculture. We were waiting for this information, of course, to allow our school districts to provide meals during non-traditional instruction when schools reopen in the fall. So those waivers we did receive on Thursday, and our division is currently working on providing further details to our school districts regarding those waivers. So on to our reopening guidance document. When we put out our guidance document was released last Monday, it was focused on in-person in the school building food service and focused on 4 main areas. And those areas are meal service environment, meal pattern, food safety planning, and operational support. So I'm going to turn the presentation over to Katie Embry to discuss each of these areas in a little bit more detail.
Thank you so much, Lauren. So today we're going to begin by discussing operational support. And Lauren, can you change the slide if you have control?
Yes. Sorry, it's not advancing. Just one moment, please.
While she's doing that, I'll go ahead and get started. So with regards to operational support, it is important to consider the meal service environment. Start your plan by identifying meal service locations in the building and service methods. You can serve meals in the classroom or other large open areas, even outside if you have that ability. Can students pick up grab-and-go type meals to help with meal service delivery? And can meal times be scheduled to allow for cafeteria use with reduced capacity? In schools, it might be possible, or it's probably going to end up happening, that during a single meal service period, multiple meal service methods may be utilized within different groups of children in the same school building. Also, with meal service environment considerations, after the location and food delivery methods are identified, consideration should be made for the logistics of meal service. Schools should identify the equipment, supplies, and resources needed for meal service methods that will be utilized. It might be necessary to stagger meal service periods so arrival and dismissal times limit the amount of contact between students in high traffic areas. They'll also need to ensure that there's adequate time to allow for proper sanitation between use of tables or other services where multiple groups of students might consume meals. And is it possible to eliminate self-service stations and the sharing of any food? Also, food service staff must be mindful of the following proper procedures to ensure student safety as well as their own. Staff will need to check their temperatures and complete any employee health screening according to district protocols upon the arrival at the workplace. If any staff who develop symptoms during the workday, they should follow the district's protocol for illness. And then staff will wear face masks unless a medical exemption has been granted. Food service staff, as well as any other staff member in the building, may be highly susceptible to this illness. Therefore, it's important to create a culture of safety amongst all staff and be good team members. Also, we have to consider the National School Lunch meal patterns. With the nationwide waivers that were just released, schools do have the option to apply for a waiver of the meal pattern. However, we want to strongly encourage schools to do their best to stick to the requirements if possible. Without a waiver, all meal pattern requirements must be met in order to receive reimbursement for the meals served. Schools should take into consideration the meal service methods and equipment that are available. Are there enough hot, cold holding equipment for transporting and serving meals in alternate locations? And do staff have time for prep work, or is there a need to purchase food items that are less labor intensive? You also need to consider accommodations for disabilities. Accommodations for disabilities, when supported by the proper documentation, must be provided to ensure equal access to the program. Meals must be served in a manner that offers a safe environment for children with food allergies. And you should work closely with all staff members, child nutrition, including anyone else in the building who serves meals to students with allergies to ensure that there's good communication and coordination to keep kids safe. There's also food safety considerations. Each school and feeding site is required to have an individualized written food safety plan. All food safety plans must include standard operating procedures for any new meal service or newly added procedures in place due to COVID-19. Ensure all food service staff, as well as anyone who's potentially involved in meal service, is aware of and has received training on the standard operating procedures. All staff must have knowledge of and training on relevant SOPs for their job, with an extra emphasis on procedures for hand washing, proper glove use, personal hygiene, serving safe food to students with food allergies, cleaning, sanitizing, food contact services, as well as the district's food health policy. And finally, there are operational support considerations. Clearly written operational policies and procedures must be developed and implemented for food service. Food service staff must be knowledgeable about those procedures. Coordination and communication must occur between the food service staff, the building administration, and other building staff to keep everyone on the same page. And most importantly, outreach and communications with household has to take place. It's imperative that student households know and understand how to communicate and interact with the child nutrition program. What methods will you be utilizing? What communications? Automated calls, emails, district website, social media, all of the above? It's important in schools that are non-CEP for families to know how to apply for the program. So how will household applications be disseminated, collected, and processed? Also think through vending machines and a la carte policies. Will visitors be allowed in the cafeteria? Ensuring that communication with households will ensure smooth operations for your program. And finally, the Division of School and Community Nutrition has several resources available for schools. We held a webinar last Thursday on June 25th, and that recording will be available for this week. Also, we have dedicated staff members who are ready to assist. If any district wants additional assistance, please email our Kentucky School Nutrition mailbox and just put COVID-19 Meal Service Operations Assistance Request, and we'll be in touch with you. Thank you so much, and let us know if you have any other questions.
So the guiding question here, what factors should KDE consider when assisting districts with preparation for food services? So feel free to comment, or you can also put your question or comment over in the chat feature. Also neglected to mention that the attendance is kept over in the participant. If you click on the participant icon, you can see the other members of the task force that are in attendance today. I forgot to mention that at the beginning. Not seeing any comments. Lauren or Katie, you did a good job. I know you all spent a lot of time listening to food service directors and others over the last few months, and I know we learned a lot as well in the closure, the last few weeks and months of last semester as we were converting to summer food service and delivery and pickup sites of food. So I want to thank you all for your work. And thanks for the presentation. And there was a question in the chat, when do we expect the pandemic EBT extension? Do we expect that for July? And the answer is that the pandemic EBT applications were recently extended from June 30th to July 10th. I think Lauren and Katie will be with us for the rest of today's meeting. So if you have additional thoughts or questions or comments about food service, feel free to put that in the chat and we will get that answer for you and or we'll record your feedback. Next up, we have transportation, a review of the transportation guidance document that was issued last Thursday, I believe. Alyssa Hanley and Kay Kennedy with our Office of Finance and Operations. And the guiding question here, what concerns are you hearing relative to the transportation of students as districts prepare their reopening plans?
Okay. So just want to make sure people can see my screen.
Yes, we can.
Okay, great. So my name is Kay Kennedy and I'm working with the Office for Finance and Operations relative to COVID-19. For today's presentation, again, as Kevin mentioned, our guiding question is, what concerns do you have relative to the transportation of students? I'm going to talk to you a little bit about what our guidance covers, and then I'm going to turn the presentation over to our Pupil Transportation Branch Manager, Elisa Hanley, who will walk you through the key components of the document. So there are pupil transportation options that have always been in place. Students may walk. You have a lot of car riders. There are bus riders. And we highly recommend that districts survey their families at this time because of the concerns around bus transportation in particular, with students being in close proximity to each other and the ability of students to wear masks to protect other students around them. These are just factors that as a transportation department, you may want to consider as you plan for the upcoming year. There may be more walkers, there may be more car riders, and traffic patterns should be examined for any adjustments that may be necessary going forward. Our document is going to talk about mitigation strategies that need to be in place to provide safe transportation on the bus. Wearing a mask, using assigned seating, doing temperature screening, and the use of hand sanitizer. Elisa will go into these in more detail. The number of students on the bus is a big factor, and how we can mitigate that risk by using multiple strategies. Our document also contains capacity charts. If you choose to do less than full capacity, based on various configurations, how many students can you get on the bus? And again, that depends upon the size of the bus and the concentration of seating that you wish to use. We'll talk a little bit about ventilation and how important that is to keeping students safe. As part of our document, we also talk about employee health and safety. That is utilizing district protocol on self-assessment health screening as employees enter the workplace. What type of personal protective equipment, PPE, will they have available? And how do we keep the buses clean, disinfected, sanitized, ready for use by pupils? So at this point, I'm going to turn off my screen and ask Lisa Hanley to take over.
Good afternoon. And I will pull up my screen and share that with you. Okay. So there are several things that we're asking districts to look at when trying to optimize the number of students on the bus. And the first thing, as Kay stated, is to poll the parents to see if they're going to send their students on the bus, drive them, or have them walk to school. And if more parents are going to drive students, then districts will need to look at the staffing that they have and ensure that they have a way to control that traffic flow. Another option is for districts to look at their bell times. To not have mixed loads of elementary, middle, and high school students on the same bus. We have a lot of districts that currently mix their loads, so therefore they're going to have younger students and older students on the same bus. This will help from loading from back to front and worries of where students will be sitting and with whom. Kindergartners may need to sit closer to the front to better see them if you have the mixed loads. So keeping that in mind, keep in mind that kindergartners will not have on masks either. Walking distances. Walking distances for older students can be increased. And for districts that pick up within a mile of the school, there are programs available through Safe Routes to School, which provide guidance on maintaining safe walking programs, which also allow younger students to walk versus being picked up. Schools can set up walking school buses where students are picked up along the mile route and walk to school with a vetted adult. And that might ease some of the concerns that parents have when their kids are walking to school. What we don't want is students crowding around waiting to get into the school, whether from cars, walking, or from buses. Districts will want to think through the processes and implement procedures that will help them facilitate social distancing. This may mean having only 3 buses at a time unloading and taking temperatures of those students while they get off the bus and enter through one door as car riders are getting temperatures taken at another door. Or buses are offloaded first, then the car riders can enter while walkers are taken through another door. There may be several doors where staff is needed to take temperatures, and using different strategies available in this document may also limit the number of students in one area that need to be checked before going on into the school. Once all of these things have been considered, there are required mitigation strategies that will need to be implemented for those riding the bus. As Kay also stated, mask wearing. All students in the first grade and above will need to wear a mask, unless there's a medical waiver for those students. So students will become used to wearing them as time goes on. We've asked districts to work with parents and students through the summer to acclimate them to wearing of the mask for the time that they're expected to be at the bus stop and on the bus. For some students, this may be an hour, and for other students, it may be 20 minutes or less. Let's see here. Seating. Districts will need to load from back to front, which is why looking at bell times is important. Younger students may end up sitting with older students with the back
in the back to front loading sequence. So students will need to have assigned seats and attendance will need to be taken before everyone leaves the bus. And this is for contact tracing. Temperatures of the students. Temperatures will need to be taken before the students goes into the school. So there's several choices that school districts have, which include taking the temperature as they enter the bus. And if this is done, a monitor will be required so that the driver can continue to watch the road and other students. Safety is paramount in pupil transportation. So if it's possible to have a monitor on the bus to do the extra duties, we absolutely recommend that. Hand sanitizer. Hand sanitizer will need to be given to all students as they enter the bus, and this can be done also by a monitor. The hand sanitizer station may be mounted, but there isn't one good place to mount it. There's different size pumps that are available, so we're continuing to work with manufacturers and dealers regarding the locations. However, during the summer and fall, when it's hot, it's not recommended to leave the hand sanitizer on the bus due to the flammability of it. We're requiring to have 60% alcohol content, so that has a higher flash point to it. Let's see, number of students on the bus. The number of the students on the bus is going to depend on the prevalence of COVID-19 in the community. It will be important for districts to discuss with their health department to determine if full loads are acceptable. And we do have charts here that range from 2/3 capacity to 10% capacity. Now, a district may determine that it's safer to load a 66 passenger bus at 2/3 capacity, which is 44 passengers. And it actually may be 40 passengers if they leave the front 2 seats open for potentially 6 students. With any scenario, we do not recommend leaving students at the bus stop if they have a temperature unless the parent has been contacted and doing so has been approved. It's much safer to take the students to school versus leaving them alone at the bus stop. Each district will need to create a contact plan and procedures to address these issues. Lastly, we have provided, ventilation. We want to leave the windows open as much as possible. However, if there are students that have allergies or other medical concerns, we would want to sit them towards the front of the bus and have the windows up. That way they are less, they're receiving less of those allergens while on the ride. And then lastly, we've provided employee safety considerations. Temperature checks for all employees should be done daily, even if the driver starts from home, which many of our school districts do have buses that are taken home. And they should take their temperature and inform their leadership if they have temperatures above 100.4 degrees. They must wear a mask or a face shield when on the bus. And for those who are unable to do so, it will be up to the district to determine if the route that they are on is acceptable without a mask. A district will be aware if there are immune deficient students on the driver's route, and they may determine to give them another route instead of keeping the students, or in order to keep the students and the drivers safe. Drivers should wear nitrile disposable gloves when assisting students. And in between routes, and at the end of the day, the buses need to be clean. Each manufacturer has provided cleaning guidelines for the buses, and the high-touch areas and any used seats need to be cleaned. This may require additional staff between routes. Each school may have someone that goes through and cleans each bus with the driver. This will speed up the time between routes that's needed. They can start at opposite sides of the bus and work their way through to the middle. This will increase the time, the extra cleaning will increase the time needed if the buses are doing double runs. In the garage, employees need to enter through one door and exit through another to the extent possible. Social distancing should be adhered to and shared tools need to be cleaned between use. At the end of the day, surfaces should be cleaned as well. Anytime a technician goes into a bus, they should be wearing a mask and cleaning the area they are in when they enter and leave. Face masks should be worn in the garage anytime social distancing is not able to be adhered to. Driver barriers are not approved for school buses at this time. There's a task force by several pupil transportation organizations that have been in contact with the National Highway Traffic Safety Administration and manufacturers working on this possible solution for the future. But right now for school buses, there's not an allowance for those barriers. I will be having a Q&A session with directors on July 1st at 1 p.m. Eastern. We've asked them to send us any questions that they have so that we can put those together and be able to answer them in that live webinar. And that's all I have at this time. And if it, go ahead.
We did have a question in the chat. I think that's been answered, but the question, some folks may not be able to see the chat feature. For those riding a bus, is their temperature checked before getting on the bus or when they arrive at school? Dr. Meserly answered either is acceptable. And I think you also heard Lisa cover that as well. So we initially were at the point where the temperature check was going to be required upon entry to the bus. However, we had a lot of conversations with public health about that and the need for, there would be a need for a monitor obviously on a bus to do that so the driver would not be distracted. And we do not have monitors on all of our buses across the Commonwealth, unfortunately. That's sometimes a cost issue. It's also, even if districts have funds, it's a personnel issue having enough monitors. And so we're able to arrive at a system where if you already have a monitor on the bus and you want to check temperatures upon entry to the bus, you can do that. However, if you want to have your parents assure you through just an assurance once a year or the beginning of the year that they will self-check their child's temperature before they present them to get on the bus, and that they're assuring you that they would not present them to get on the bus if their temperature were above 100.4, then the child's temperature would not be taken until they actually got to the school. So you do have that option, but at the very least, every child's temperature does need to be taken by school personnel upon entry to the building. Any other questions or comments on transportation? And I do want to clarify that we do have the charts in there about capacity, but that needs to be done, and that determination with your local health department. It is possible to fully load a bus, assuming the certain requirements are met and every student has masks, but there are obviously some risk factors there, as was stated in the presentation, if there is community spread going on in your community. So again, you need to make sure you're having those conversations with your local health department. A comment here about the parental assurance. Even though that's trying to save the district some work, we understand just getting an assurance from parents in addition to everything else you need to get from them could also cause some problems. So Robin Kinney commented that we're working with the student information system provider, Infinite Campus, to see if there's a way to do the parental assurance online through the registration process. Hopefully reduce that burden, paperwork burden. All right, if you have other question here, if buses cannot be at full capacity, how will the riders be determined?
So Kevin, this is Kay. Again, that flexibility is left up to the district. I think it depends on the instructional model that they're going to be using, whether it's they're going to be running at full capacity, and the extent to which ridership is needed on the bus, as opposed to parents who may choose to transport the children themselves. Again, that's an evolving situation and will depend on what's going on in each district. And I assume that as part of the planning and the taking a poll of the parents, that's a detail that will be worked out and communicated well in advance to the start of school so that folks can make arrangements.
I do think it's a good point that, and several superintendents have made this point, and I'm not sure if they're starting to see this data through their surveys, but I think we're expecting an increase in car riders just because of the nature of the virus and that type of thing, and at least for the first few weeks. So it's going to be important, as was mentioned in the presentation, that schools also, in addition to taking care of the bus issues, may have to reevaluate how they handle traffic flow with an increased number of car riders. Okay, next up we have Marshal Ben Wilcox. He's our state school security marshal with the Department of Criminal Justice Training, and he's a member of the task force and has some news for us.
Thank you very much, Commissioner Brown. It's my pleasure to speak to you all today. I was asked to give an update on the Marshal's Office and the mandates with the State School Security School Safety and Resiliency Act a couple weeks ago, and I declined the offer, and I said I really wanted to wait a little while until we figured out what we were doing going back to school and getting my compliance officers back into school, restarting the assessments. And so Karen asked me to give an update today, and I'll kind of show you where we're at and what we're doing and how it's going to affect going back to school for the 2020-2021 school year. My assessors were able to get back into schools in end of May. We are at about 1,100 schools completed. We have 300 more schools to go on our initial assessment. This is the assessment that is kind of on us. It's not going into a report. We're building relationships with our schools. We're letting our compliance officers build relationships with their assigned districts and going over in the assessment tool, the first draft assessment tool that we had. And even with a COVID situation, we've been able to do 1,100 schools, and we're on track to get almost everybody done before the start of the 2020 school year. With that being said, we were required by law to have an assessment tool completed July 1 of 2020. We have done that. We have had it approved through KCSS and also placed into reg with KDE. We worked directly with KDE. There they go. Placed into regs, and then of course we worked with our compliance officers and school districts and superintendents through LSAC to find out what the best look for that assessment tool is going to be. And it's basically the same questions, but it's separated out into a much easier read and a much easier way for schools to understand what is a shall or what is a compliance issue and what is a current trend. So we're very excited to get that program going, and when the 2021 or 2020-2021 school year starts, that's when we'll start the new assessment tool. We're actually trying to break it right now. We've got some great IT folks that basically said, go out, practice with it, and see what works and what doesn't. And our folks are out doing that right now. Some of the questions that we've run into, and really what we wanted to do at the Marshal's Office was sit back. We've been involved in the superintendent meetings. We've been involved in the task force meetings. And of course, with getting our compliance officers back into the schools, we've really taken a whole lot of notes and figured out what the questions are going to be as administration, staff, and students arrive back at school with the COVID issues. The one question that we did have was regarding, we've only had it from a couple schools, is there going to be a issue with locking of interior doors during instructional time with the COVID issue and ventilation. We contacted the Kentucky Department for Public Health, and we had them look over the School Safety and Resiliency Act, and they said they didn't see any issues with keeping the interior doors locked during instructional time. We will take that also by a case-by-case basis. One thing I've learned in this job is there's 1,410 schools in the state of Kentucky, and every one of them is different. So we'll be looking at that as we go back and start our assessments. There is a part of the SB 8, which includes a exemption for locking of interior doors. If we run into any kind of issues with public health saying that that's an issue, then we'll deal with it on a case-by-case basis and get it fixed as quick as we can. The greatest thing we've got in this office is the ability to put a compliance officer in a school within a day of getting a issue and solving that issue as quickly as possible, and working with schools to make that and districts to make that happen. One of the other things we looked at is the Department of Criminal Justice Training is required to make an active shooter video response for staff. And one of the things we wanted to do, and in working with KDE, we really would like the staff to watch that video together. And for obvious reasons, with anxiety or questions that could come up in regards to how to respond to an active shooter. We all know that that may not be a possibility to get everyone in one room. So we've worked with KDE and also with the Department of Public Health to put out some guidelines and suggestions to schools when that video does come out of how they can safely watch it as a group or maybe as groups to able to make plans to have a plan if something like that should happen at their schools. Really don't want to take a whole lot of time other than just give you the updates that we are doing at the Marshal's office, but I really do want some folks to sit back and think. We've done a lot of talk about social distancing, wearing masks, things of that nature, and that obviously is the biggest concern we have, but we don't want to forget the security and safety of our kids when we start coming back. If you look at it, we've had kids out of school in upwards of 6 months by the time they come back. There's going to be some issues that they had at home. There's going to be concerns. We're going to have parents that may be upset, and we want to make sure that we are following all the compliance that has been set forth by the School Safety and Resiliency Act. And what I really want to do is if schools do have issues, if schools have questions, get a hold of our office. If it's something we can't answer, we'll get you in touch with John Akers over at the Kentucky Center for School Safety, and we'll put a compliance officer into your school and go over things with you in person with a 6-foot distance and a mask on about questions you have regarding specific spots in your school or specific items. At the Marshal's office, we didn't hire anybody that's afraid to speak in front of a group. So if you need them to come in and speak to a teachers group or administration or ask questions in regards to how this is all going to work and how it is going to be reflected on the mandates set forth by our office, or not our office, by legislation for the School Safety and Resiliency Act, please call. We'll send compliance officers to your school to make that happen. And again, if we don't have the answer for it, we'll find somebody that does. And if they don't have the answer, we'll work it all out together. I really want you to know that the Marshal's office is here to help. We are a resource. Even though we are a compliance agency, we're also a resource. I'm kind of going over my notes, and I know I haven't taken a breath in about 15 minutes or 10 minutes, however it's been, but I really didn't want to take a whole lot of time. I know that you've got a lot of stuff working right now and a lot of questions to be asked in the next month. I guess the biggest thing is that we're willing to help you answer any of those questions and work with you any which way we can to keep kids safe and obviously keep kids healthy.
Thank you, Marshall Wilcox. Any questions? Feel free to ask or put those in the chat as we move forward. Really appreciate you being with us today, but also all along with us along the way over the last few months.
Thank you, sir. You have a great one.
Thank you. Next up, we're going to have a discussion on the guidance document that was issued last week.
Kevin, we had one other topic, the facilities guidance, and Kay Kennedy was going to present that.
Oh, okay, great.
So Kim and I will share my screen. And I don't believe this document is out on our website yet, but we do have it ready and it should be out shortly. Let me see. I want to share my screen. All right. All right, there we go. So our guiding question for reopening schools in terms of facilities and logistics is what needs to be done in school facilities to best prepare them for students in the fall. Our document really focuses on these 5 components: cleaning and sanitization, facility utilization, building systems, emergency drills, and operations. So at this point, I'm going to actually stop sharing this document and share the facilities guidance document, which is Pardon me just 1 second while I get that document. Go. All right, you see my document now?
Yes, we do.
Okay, great. So the guidance in this document is really based on guidance from the CDC, and we refer people to that frequently, to that information frequently. So there is a distinction between cleaning, sanitization, and disinfection that we want school districts to take into consideration as they look at their custodial processes for the upcoming year. And certain areas need to have regular cleaning, certain areas need to be sanitized, certain areas need to be disinfected. And what we've done is provide a worksheet with this documentation that allows you to inventory the spaces in your facility that will allow you to determine the type of service that's needed, whether it's cleaning, sanitization, or disinfection, the frequency of that service, whether it needs to be done hourly, daily, or a specific time frame, what products are to be used, and other instructions that may be relevant to that particular custodial task. So again, this is an activity that can occur anytime during the summer break, to get that information ready for school reopening in the fall. But it's also a handy guide to have in case you need to have substitute custodians if a custodian should fall ill to the virus or anything else really, and you have a substitute in the building, to be able to provide them with specific information on how the areas need to be handled during the day or during a longer period if necessary will be very important to the operation. Obviously, there will be certain products that may need to be used that will require the use of PPE for custodial staff, and those needs should be documented and monitored throughout the day, throughout the week, so that you can identify the burn rate of that particular equipment and have plenty of it on hand for future use. Another key component for school districts to consider is facility utilization. Based on the instructional model that the district chooses, there will be different number of students in the building. And what we've done is provide sort of a generic table here that will allow you to calculate your capacity or allow you to evaluate the capacity based on the dimensions of the room, the usability of the room, and how much space you can allow for students in that particular room. So as an example, in this table, we've got 5 different room sizes utilizing 75% of the available space in the classroom. And based on that, you can then identify how many students could be in that room that would achieve proper social distancing. And as we've stated before, and from our work with the Department for Health, we understand that students should be wearing a mask when they're moving throughout the building and even within the classroom. But in the event the students are seated in the classroom, not up and moving around, they do have the ability to take a break from their masks if they can achieve social distancing. And this particular chart allows you to know how many students you could have in a classroom and achieve that social distancing so that you can get a break from wearing of the masks. Within the facility, the planning team should consider other improvements for mitigation strategies that would include multiple hand sanitizer stations, how you're going to be able to replenish your sanitization products, your hygiene products like soap, paper towel, etc. Is there an opportunity to utilize plexiglass shields in public-facing spaces such as the reception area or in the cafeteria with sneeze guards and cashier shields? Do you have the ability to utilize no-touch trash cans? Also, there is signage available to publicize these strategies. This is available from the CDC on their website, free of charge. And that you should consider water fountain procedures. And CDC recommends that students bring their own water bottles and have the ability to replenish those without putting their face in the water fountain per se. This document also describes consideration of building systems, and in particular focuses on the HVAC component of the building. We rely on documents from the ASHRAE, the American Society of Heating, Refrigerating, and Air Conditioning Engineers. They have a couple of position papers and some guidance that we referenced in this document and linked to it. The important thing is that regular maintenance should be done on filtration systems within your HVAC, changing those filters maybe a little more frequently than you might, and making sure that you've got plenty of good ventilation. And then recommendations about what happens if you do get in another closed down situation. How should those systems be handled if the building is not going to be used for a period of time? So the main things that you need to consider in terms of the HVAC are the concepts of dilution, filtration, and purification. And those topics are discussed in the document. The next component of our guidance is the topic of emergency drills that the Kentucky Center for School Safety has advised us on. How to conduct fire drills, lockdown drills, severe weather drills, and earthquake drills. So in a nutshell, the guidance is continue to conduct those safety drills, but do them in a manner that allows you to maintain social distancing and still get the point across to students. So that may involve smaller groups of students running through the drill on particular days. And the recommendations included in the documentation describe how that can occur. If you've got any questions about the lockdown drills, please feel free to contact John Akers at the Center for School Safety. As has been mentioned before, please consider vehicular traffic control in at your facilities, as this may change depending upon how many car riders you have versus those who are riding the bus, and we want to keep students as safe as possible. And that means looking at drop-off and dismissal, and being able to communicate clearly to parents that students will have to go through a temperature process upon entry to the building, and we don't want to have congregation of students outside a building where they can't maintain social distancing, or there may be severe weather going on. You don't want kids standing out in a thunderstorm, but how can we get those kids moved safely through a health screening process that will allow us to take their temperatures? So we've got a number of scenarios that are described in the document, and would ask districts to consider those. And you may have to blend scenarios to be able to handle getting kids into the building in a safe manner. So this could involve extra time needed in the day. And we've had some discussion about how that may affect your bell schedule and the flow of traffic in the building once kids get in there. Student dismissal is a little bit less complicated. We do not advise taking temperatures to get back on the bus, but if a student has developed a fever during the day, they should not get back on the bus, but a parent should come pick them up according to the district's protocol for a student who becomes ill at school. So back to the building security that Marshall Wilcox talked about. The CDC recommends opening doors and windows to improve the building ventilation, but we don't want to conflict with the emergency management plan that the district has developed in conjunction with the Office of State school security. So please work with those folks should you have a question about how you want to improve ventilation and make sure that we get that done in accordance with their guidelines. So the document ends up here with a sample of the site inventory worksheet that I talked about earlier, where you have a number of locations that you want to make sure that you know how you're going to clean them, what products you're going to do, when you're going to do that, and if there's any other instructions that you want to give a staff person about how to handle that area. So we do have that. Most districts probably already have a sample custodial checklist or a custodial checklist that employees can use to check off various tasks that they do either on a daily basis or maybe every other day, just to make sure that those are being accomplished. Here's an example if a district doesn't have that available. So with that, I will ask for any questions.
Okay, we have one question from forwarded to us from the Jim Flynn, received by Superintendent, regarding the types of sanitizers allowed and whether or not schools can use alcohol-based sanitizers. And I think this is not talking about the hand sanitizers, but about for other sanitation purposes.
Right. Our document does contain a link to those products that are approved by the EPA and that is on CDC guidance. So I would suggest we start there. Again, with some of these stronger products, you do have to be careful about how they are used and make sure that employees are trained on the usage of any products that they may not be familiar with. In case there's additional PPE that a person may need to wear to utilize those products. But again, whether or not a product is effective depends upon how correctly it is used by staff. So training is an important component of that. So I think you'll find a link to that, and we always reserve. I think we have a good relation with DPH that we can go back to their environmental folks if there's a question about a particular product. Whether I know I had one question last week about a particular product that a district was considering for use on the bus as a sanitizer, and we sent it over to DPH, and they were able to track it down. It was not on the approved list, and so we relayed that back to the district, and they can make a decision based on that information. But we certainly do encourage folks to use the approved products.
Comment from Dr. White says that the Kentucky Department of Public Health is developing a training program with the Eastern Kentucky University environmentalist to give local health department staff more training. And I can't see the rest of it for some reason. So
Kevin, that's talking about ventilation issues. So
okay.
We certainly appreciate that partnership as well. There are a number of things that we are learning. We need to find out more information about, and certainly are happy to have a partnership with higher education to be able to provide that training.
Feel free to add additional comments, suggestions, questions in the chat feature. Okay, thank you for this. I apologize. I guess I was not paying attention at staff meeting this morning. I forgot we were going to cover that today, but thank you for that. And that will be going out, I think, momentarily to superintendents. All right, next up, we are going to have just a discussion about, and before we move off on this, a question coming in from a task force member. Will districts be setting up their own lists for employees to be tested? Will this become a local policy? this is probably a good segue into our folks from public health as well. But Kay, do you have any feedback on that?
Yes, Kevin, we will have a document that's scheduled to be published next week that is a companion document to the Department for Public Health document that came out this week, where we have outlined for districts some additional considerations that they want to give to implement the guidance provided by DPH. And so a health screening is a good example. How you, the protocol that you want to follow if a staff member or a student is tested and becomes known as a positive case, or if they have been exposed, what's going to be the district protocol. So the screenings and the protocols and some of those administrative type tasks that need to be done so that we can be good partners in the contact tracing aspect of managing this disease. Those will be forthcoming in our document next week.
All right, thank you. Next, we will move to a discussion around the guidance that was issued last week by Public Health Department, Education Workforce Development Cabinet, and also KY Stats. And that's what I refer to as the flagship document. That's the document that's now informing all the others about expectations and best practices for reopening schools. And Lieutenant Governor, do you want to make a few comments before we get into some questions? I'm not sure if she...
Kevin, this is Mary Pat. I think she had to drop off.
Okay, I thought that might be the case.
Yep.
As you all know, we had the press conference with the governor and lieutenant governor and our Dr. Stack on Wednesday. It just so happened to be the last regularly scheduled press conference of this time. I'm sure we'll have some special ones upcoming. And when we released the Team Kentucky Healthiest School Guidance document, we also announced the issuance of a memorandum from myself to local school district superintendents pursuant to Executive Order 2020-243. That was the initial, or one of the initial emergency executive orders issued by the governor on March 18th during the start of the pandemic. And as provided in that executive order, we were able to temporarily waive some statutory provisions related to the emergency upon the signature of the Cabinet Secretary. Lieutenant Governor is the Cabinet Secretary for Education Workforce Development. And so she signed off on that memorandum. That does two things. It suspends the number of NTI days. The limit on those in current statute is 10. As you know, Senate Bill 177 also last year for last semester allowed us to increase the number of NTI days upon the approval of the commissioner, which we did in order to get all school districts through to 1,062 hours. We're going to use this memorandum to do the same thing in line with Senate Bill 177 for the next upcoming fall semester. And then also because there are questions around the flow of funding, because districts are now anticipating the need to educate students at home while at the same time educating students back in the classroom due to various reasons, sometimes due to a district's own decision to decrease the number of students in a building to have alternative schedules, some school students reporting some days, some others, or we're also hearing due to districts are sending out surveys and finding out that a certain percentage of their parents do not want their students coming back into the classroom, even though it is they are able to do so using social distancing and PPE. They want to wait that out a little bit, and we also understand the fear there. And also it could be because some students are living with members of their household that have health issues, and they don't want to take an additional risk of the student being out in a crowd, even even in a school with protective measures in place. So schools understand they have students that for the first time, at least in recent history, that they need to educate both places at the same time, whereas normally and always before, we either educate everybody at school with few exceptions such as home hospital, or we're educating kids at home, everyone at home using NTI as we did to finish up last year. And that we now have a different method that we need to address. The statutes do not address that type of model. And we want to make sure that we're providing districts with the flexibility to reach kids where they are and families where they are. And so that's the second part of that memorandum, which suspends various limited portions of statutes so that we can temporarily uncouple traditional seat time attendance from ADA or from funding. And that will allow funding to continue to flow to districts, and they get to make the choice of how they're going to serve their students. And it won't be necessarily dictated on where the student is. And this doesn't provide an incentive, and it doesn't provide a disincentive for districts to provide that service to a student that may be at home. That will need to be followed up with an emergency regulation of the State Board of Education, and we anticipate that the State Board taking that up probably the week of July 13th. Prior to that, I will be testifying in front of the Interim Joint Committee on Education on July 7th about this plan and this waiver and this emergency reg that we're drafting for the State Board. And then we will have the Local Superintendent's Advisory Council, of course, weigh in on the draft regulation, and then it'll go to the State Board at a special meeting. Hopefully by July 15th, we will have that in place. So I want to thank the Lieutenant Governor as well, and also the feedback from folks on this call and the superintendents on helping us to get where we are with a very temporary change and waiver to get us through the next few months of school. Then, of course, we know the General Assembly comes back in January, and more permanent decisions can be evaluated and made, of course, by the General Assembly if any permanent changes to statute need to be made, or even temporarily to get us through the remainder of the year. The document, of course, that we talked about was a team effort, as I mentioned, among various state agencies. I also want to thank KY Stats. They took the document, and if you've seen it, the document does a really good job of providing graphics and shading. It's a document that can be referenced by parents easily understood, also very helpful, and is detailed enough for school administrators and teachers. So I really want to thank KY Stats for helping us format that document. The formatting of it was based upon some feedback from superintendents who had seen some documents in other states, and KY Stats stepped up to the
Kevin, I think you're on mute.
I won't go into the specifics of the document, but we did that during the webcast. If there are areas you want us to dive into as part of the task force, we certainly can do that. If there are lingering questions out there, something that may be confusing, we have Dr. White with us. And also Dr. Meserly that with Department for Public Health, and we can get those questions answered. We know as in you've heard the governor talk about the Healthy at Work document that has changed along the way, and they encourage employers, I think, to continue looking at that, because as the virus changes, guidance may change. And so we want to make sure we're continuing to listen to schools, districts, all of our partner organizations as we move forward, to the extent that some things may need to be tweaked or changed. And Representative Bojanowski, I think you have a question.
Yes, thank you. So this question kind of has to do with the temperature of 100.4 kind of being the guiding light between sick and not sick. As a teacher, what we find, or what I've found often in the classroom, is you'll have a child who doesn't feel well. You have to send them down to the office. The office takes their temperature and they may not quite have what the temperature requirement is, and the child's sent back up to the classroom because they don't quite have that cut off. Has there been any discussion about having school nurses who can maybe make more of a determination that a child is not well, in addition to whether or not that child has a temperature of 100.4? And is there a confirmation that the school nurses could be hired with Medicaid funds?
Okay, that's a great question, two-part question. I think we would probably need both Dr. Meserly, Dr. White, and maybe Angie McDonald from KDE. Kay Kennedy, I think you're volunteering, so you can start off.
Go ahead, Kay. This is Dr. White. Can you hear me, Commissioner?
Yes.
Okay.
Yes.
So in the guidance that comes out next week, we do encourage districts in developing their protocols to spend some time talking about what of those sort of health assessment activities can occur in the classroom. When should a child be referred to the school nurse? Not as you know, not all schools have a nurse. We certainly encourage that during this point in time, that even at a minimum, if you can get some sort of a licensed healthcare person, could be a licensed practical nurse or whatever to assist, but that the district spends some time talking about how those self-assessments could be most productive and really get students where they need to be best served. And if a student, even does present with a fever, what do you do with that child in the period between the time they're identified as symptomatic and somebody can come pick them up? What's the best way to isolate that student? What's the best way to keep the exposure of that student to other students at a minimum going forward? So our state school nurse, Angie McDonald, is working with her cohort of state school nurses, and we're working with, of course, obviously the folks at the health department who are part of that school nurse group as well, to figure out the best way for that to work. And the good part is that schools now have better inter-office communication through telephone systems and even sort of personal communication systems that may be able to facilitate how we can get the best care for students. Now with COVID, not only is temperature an indicator, but there's really a whole list of symptoms that we want to be able to have folks assess and make a good determination. So that is part of the information that school districts need to be evaluating going forward and making some sort of documentation or protocol listing available so that folks will understand what their role is in that whole assessment process. Angie, I'll turn it to you.
Okay. It's kind of ironic that 2020 has been named the year of the school nurse. Who would have thought that, this was going to be the one time that we're going to need them the most? And that's definitely going to be the case this year. Ms. Bojanowski, I appreciate your question because school nurses are needed now more than ever. And as we know, there's not school nurses in every building. I've really encouraged superintendents to look at some of their ESSER funds, that this would be a good use for them. And yes, Medicaid funds could be used toward hiring a school nurse. As Kay mentioned, you could benefit from a licensed practical nurse or even a very seasoned nursing assistant, but that nurse still has to be supervised by a registered nurse somewhere in that district. So if you don't have any nurses at all, you can't just hire an LPN or an aide, and that would satisfy that requirement. We're not asking school nurses to do COVID treatment and the testing in the school. That's a very invasive type thing, and prefer parents be there and that sort of thing. And plus there's a laboratory testing waivers called CLIA certificates that would have to be determined. Some that have school-based healthcare clinics with nurse practitioners or whatnot, they would have that ability to do so, but just your routine school nurse will not. He or she will assess the student and then refer to their healthcare provider for that testing. We've been asking them to go ahead and start making up some little checklists for classroom teachers on things that need to be sent to the nurse versus some things that maybe possibly could be handled in the classroom. So we kind of limit kids getting needlessly exposed to COVID symptoms in the nurse's office. So we're trying to get all those things in place, and our school nurses do a great job with this, especially in the flu season. I tell them to go err on the side of caution, because you have that gut feeling that kid's sick. He may not have a fever, but that kid's sick. Then they have the ability to send that child home and refer them for medical treatment.
Representative, does that answer your question? This is Dr. White from Public Health.
Yeah, it definitely gets me started, and it very much wants my building to actually have a school nurse in it too. So I guess that's a major concern, is where do we stand on all of the buildings who do not have school nurses, and where that decision, the guidelines will be made, but when push comes to shove, if they don't have the fever, they come back up to the classroom. So hopefully those guidelines will be shifted so that potentially contagious children aren't exposed to the teacher and the whole classroom. But thank you, I appreciate it.
And related to that, if we can go ahead and answer, there's another question I'll go back up to, but then here's a question related to this discussion. Will a medical statement be required for an identified student to return? And I assume that's a student who has been identified with a positive test for COVID-19. Dr. White or Angie, can you comment on that?
Well, I would assume that if a child is COVID-19 positive, that they would need to serve out their self-isolation time, and then the health department will release them from self-isolation. Or if they are a contact of someone that's positive for COVID-19, then they would have their quarantine time, and so they would be released that way. Or a healthcare provider who has diagnosed them would say, yes, little Kevin can come back to school now. If I were a principal, I would request something like that. I don't know if y'all can mandate it. I don't know your rules, but I think for the protection of your other students and your faculty, you probably ask for that. But I'm getting out of my lane.
Okay. Any follow-up from KDE staff on that one?
So Kevin, this is Kay. The CDC guidance puts a lot of time restriction, like 3 days free of fever, or 10 days, from the time that you're identified. A lot of that depends upon whether the child who tested positive, for example, was symptomatic or asymptomatic. So in our guidance that will be coming out next week, we're going to be referring to the CDC guidance as districts develop their protocols, and ask them to take a look at that. And I think be well advised to, again, err on the side of caution. It's important to have students in school, but we want to make sure we do that as safely as possible.
And I would like to go back up to the, I would like to go back up to Julian's comment at 2:04, where he asked me a question and says that the NCAA sports medicine chair in a call this morning said that CDC is going to change their guidance on quarantine from 14 to 10 days. So if that's true, then I haven't heard of that. CDC doesn't usually consult me before they make changes. So that would change everything that we've talked about up to this time. Up until this time, we've been told that you want a 14-day quarantine period. So that sounds like, from this caller, that could change to 10 days. So, and that there's some change in thoughts about face shields. So in the minute that information does come down to us from the CDC, and I've reviewed it with Dr. Stack, we will certainly pass that on to Commissioner Brown and staff, and we may need to come out with 2.0.
Which is a perfect example of, as we've heard the governor talk about healthy at work, things do change. And obviously we're working with not only public health, but obviously CDC from a national perspective. And so there will be, I'm sure, additional versions and updates. When we do additional versions, we will make sure we update schools. They know what version it is. We'll make sure that we highlight the changes from a previous document that they may be working from. Todd Allen, I think you had a comment.
Yes, thank you. I was just going to remind that local boards, nearly all local school boards, already have policies in place for controlling infectious disease and communicable illness. So I would recommend that they look there as well for protocols and guidelines that are already in place in local school districts for bringing a student back whenever they've tested positive for a communicable disease.
Thank you, Todd. I have a comment here relayed to me from KASS, Jim Flynn, and coming in from a superintendent, that there's quite a bit of confusion out there about the value of temperature checks for all students and staff prior to entering the building, concerns about the benefits of the practice since many students will be asymptomatic, the unpredictability of temperatures at any time during the day, and the risk of an unintentional miss of students. And then the question being asked by several superintendents, is the benefit worth the risks, logistical challenges, risks, and costs? Dr. White, I'll turn that over to you, because I know when we had discussions with public health, you all very much value, and we support you on that, the temperature check as being a very essential tool. And I will mention, and this is related to the second comment, that public health was able to get us to a place where not requiring the temperature check upon entry to the bus, but upon it, at the very least, it has to happen on entry to the school door. Ideally, if you do have a bus monitor and you can check them upon entry to the bus, then that's great, because that would reduce the time once you get to school. And then also the ability of us the second part of this question is, could we consider a compact with families to ensure an acceptable temperature check? That's what we're referencing in the assurance document. We're not calling it a compact, we're calling it an assurance document. And we hope to be able to have that facilitated by electronically through Infinite Campus, so that parents, if they sign the assurance document, they're assuring the district that they're not going to present their child to get on the bus if they have a temperature higher than 100.4. That gives us a little bit of assurance, knowing the child will have a mask on the bus, and the child will be checked for temperature when they get to school. Now, back up to the original question, Dr. White, if you could talk a little bit about the importance of temperature checks and why those are in the guidance and as an expectation.
From what the reading that I understand from the CDC and other documents is that fever is one of the most consistent symptoms that people have. There's that long list of other things that you could have, but almost everyone who has symptoms has a fever. So we think that catching that early before symptoms of cough, shortness of breath, and rash and all the other things that we list, that's one of the earliest harbingers that there's a problem. So that's why we think the temperature check is important. But the caller is correct. About 20 to 40%, depending on what document you're looking at, are asymptomatic. That means that 60 to 80% of them are symptomatic. So I think if you're looking at odds, I would go after something that's going to give me an early sign 60 to 80% of the time that someone is ill. It is not a panacea. And if you check every child's temperature every day, if you checked it 3 times a day, there is still going to be a child coming through with COVID-19 that's asymptomatic that you just flat won't be able to catch. But 60 to 80% of the time, you are most likely to catch them with that elevated temperature early on.
Thank you.
Did that cover all the, it was a
Yes,
multi-question
it
question.
was.
Okay.
Yes, it does. Any other questions or comments about this document? I do want to point out in the document, for example, you'll see, for example, there's about a page spent on talking about the cleaning and sanitizing of gymnasiums, physical education classroom and weightlifting rooms, several bullet points, playgrounds, food service. And so you may ask when you see the document issued last week, well, that's not a lot of information about that. Well, this is the document issued last week. This is the basic expectations from public health and the department, as well as best practices. And those expectations are summarized in those bullet points. And then we issue additional guidance documents. A perfect example of that is the transportation guidance document that goes into great detail about how you sanitize, or contacting the bus manufacturer specs on sanitizing certain surfaces on the bus. So that's when we get into those details, and that's why we have about 15, I think 12 to, or we will have around 12 to 15 guidance documents out before the start of school. We already have, I think, around 10, including this flagship one here. So if you're reading through there and you think, well, that doesn't give a lot of direction to schools and districts, just know that these are the major expectations, and then we get down into the specifics in the other guidance documents. And of course, all those guidance documents are available on the KDE COVID-19 webpage. Any other questions or concerns, feedback? We are going to have a Superintendent Advisory Council next Monday. We're going to go over the document with them. That's another week of being into some implementation, or at least review of the document. I know it's a holiday week. We discussed about not having today's meeting and not having next week's Superintendent Advisory. However, we thought it was necessary despite the holiday, and I know everyone's getting tired, but because the guidance came out last week, we thought it was essential that we have this meeting for the next few weeks and not skip any, even though we may have some folks that won't be able to attend. However, today's meeting, I think we have great attendance. And then we'll be back here on July 13th for upcoming the next task force meeting. As always, as a task force member, if you have an update related to COVID-19 that you want other task force members to hear about or give you feedback on, even if that's just an announcement of an upcoming training or something your organization may be conducting, please feel free to let Karen Dodd know on our staff, and she'll get that on the agenda. We try our best to get feedback from the task force and then incorporate that into guidance. It doesn't always work that way. Sometimes you're on that end, the front end, sometimes you're on the back end, and the same thing with all of our other advisories, as we've been moving pretty fast. But I've been very pleased with everyone's assistance and the teamwork involved in getting all this done. I know there's a lot of anxiety out there about starting school, but I believe we're in a much better place now than we were last week, just because a lot of this is coming to fruition, and we're able to see a little bit better clarity of what it's going to look like. Any closing comments? All right. As I mentioned earlier, we'll have the superintendent advisory on the 6th. Tomorrow we have our regular superintendent webcast from 2 until 4. Hope everyone has a great 4th of July weekend. We'll be back here on the 6th from 1 until 3 with the Superintendent's Advisory Council, and then again the Superintendent webcast on the 7th. On the 7th, don't forget, your state board is likely to be making some type of announcement or decision on the next Commissioner of Education. And then also on the 7th, I'll be testifying in front of the Interim Joint Committee on Education about reentry and the document I spoke of, the memorandum on the waiver and of some of the attendance and funding issues. Everyone have a great rest of the week. If we can be of assistance, please let us know. And don't forget the exit slip. It's in your chat. This is it'll take 2 to 3 minutes for you to fill out. This is a great way for us to learn about future meetings, what we need to do differently. And then sometimes it may just be your preference to put your comments or questions in that, so it's not on the chat, or you may not want to raise your hand, so feel free. We look at the exit slips just like we look at the chat, or just like if you were speaking out during the meeting. So please take time to do that. We do look at those. Everyone have a great rest of the week. Thank you.
Thank you.